All right. Hi, everybody.
Hey, Zoma.
Hello, hello. Do we still have, is everybody, I feel like maybe, are we frozen or are we okay? I'm
We are good.
okay. Great. Jacob, good. Awesome. So it is 7:00 something on this lovely Thursday. Is it April Fool's Day? It is April Fool's Day.
100% April Fool's Day.
I feel like I missed out on the best part. I realized only not long ago, like literally in the last maybe half an hour or so, that it's April Fool's Day, and I regret so many pranks that I didn't execute today. So many posts I wanted to make that I would have been hilaring about all day long that didn't happen.
File them away for next year, my friend.
Sure. So thank you so much to Johnny and to Jacob and to the folks who are working to make sure that we can hold space tonight and have this conversation. Is it okay if I kick things off, Johnny, and talk a bit about why we're here? And yeah. Okay, so my name is Uzoma Asaguera. For those who are watching, I am a registered psychiatric nurse, an addiction specialist. I'm also a politician. I'm an NDP MLA. I represent the constituency of Union Station, which is the core of downtown Winnipeg. And really thrilled to be here on Treaty 1 territory, home of the Anishinaabe, Cree, Oji Cree, Dene, Dakota people, and homeland of the Métis Nation. We are here to have a really important COVID conversation. This is part of a series of conversations we're having during this pandemic, talking about all kinds of things. Talking about housing issues, substance use, community, all kinds of things that are important to talk about, that affect people, that are impacting folks, and trying to find constructive, productive ways to navigate that dialogue and solutions to make things better for all folks in our communities, but especially those folks who are navigating systems in which they're really targeted and systems that don't serve them equitably or well in a lot of ways. And today's conversation is geared around safer consumption sites. And this has been a hot topic for recent years anyway, in my recent memory here in Manitoba. But we really haven't seen any traction when it comes to consumption sites, and I would say the larger, broader public, and in terms of policy at certain levels. So really, really grateful to be able to meet with some amazing folks tonight. We are hoping a couple other folks that you would have seen if you saw an advertisement on social media. We're hoping they can join us. But right now we've got some pretty amazing people here. We've got Johnny from the Manitoba Harm Reduction Network, who I'm going to let them introduce themselves. And as well, we've got Jacob from lots of things, but Main Street Project, I believe, is someplace that Jacob can talk a bit about. So I'm going to leave it to you two. Maybe Jacob, if you want to introduce yourself first, and then Johnny, if you wouldn't mind following up, and then we can get right into the conversation.
Awesome. Hi, everyone. I'm Jacob Kaufman. I'm currently a peer advocate at Main Street Project. I'm originally from Vancouver. I went back there a few years ago to work the front lines in the opioid pandemic. And I worked at both a safe smoking site and a safe injection site. So it's amazing to be here, work with some really awesome people, and thank you so much for having me.
Fantastic. Jacob, Johnny.
Hi, everybody. My name is Johnny. I'm holding this space here for Dawn, who was a peer who I hope will be joining us shortly. And if they're not able to, then that's fine. We'll continue on. But if I do happen to jump out and you see somebody else here, that's the reason why. I am the coordinator for the Winnipeg Harm Reduction Network. I work for the Manitoba Harm Reduction Network. And some of the things that I bring to here is decades of drug use experience, as well as an understanding and hearing from peers what it is that they're wanting, what it is that they're hoping for, what they've been asking for years and years, as well as to talk about some of the peer-led initiatives that are happening because of inaction of government and policymakers. So I'm happy to share those things with folks today.
Wonderful. Thank you both so much. And so let's just dive right in. Let's just get right into it. So something that I was thinking about this conversation and, what we're going to talk about today. And I had this memory. I reflected on a moment actually during the 2019 campaign, provincial election. I was knocking doors, trying to meet people in the area and talk about issues, hear from folks what, their concerns were. And I happened upon a house where a couple asked me some really direct questions about safer consumption sites. That was actually something that they put forward. They were like, we keep hearing about safer consumption sites. We don't get it. We don't understand why you would support that and what that's about. And we ended up having a really great conversation, probably a 15, 20-minute conversation about safer consumption sites. And by the end of the conversation, they were like, thank you for that information. We didn't know any of that. Lots of misconceptions about it. And so I'm wondering if maybe we can start the conversation by kind of like an intro to what are we even talking about when we're talking about safer consumption sites? What does that even mean for folks who really maybe are hearing this for the first time, don't know? How would you put that together for them? Maybe I'll tap high five Jacob.
Awesome. So for me, and in my experience, a safe consumption site is simply a safe place for people who choose to do drugs, to go to drugs in a safe environment where if they overdose, if they suffer from drug poisoning, if something goes wrong, there are trained people there to help them. And it also gives them a more dignified place to use. I've been clean off heroin for 21 years now. And when I used to use, it was in a back alley on Hastings. This was before there were supervised or safe consumption sites were not around. And it's just, it sucks because you feel subhuman. And yeah, it's safe consumption sites are simply that, a safe place for people who use to go and use without dying. Because the facts are that if you use a safe consumption site, your chances are you are not gonna, that nothing will go wrong. There will be someone there to help you. So it's, yeah.
Okay.
That's what I think it is.
Okay. Thanks, Jacob. Appreciate that. I want to give a hello to Dr. Mark Tyndall, who's joined us, one of our other folks on the panel today. Hello, Dr. Mark.
Hello.
Really glad you could join us. If you wouldn't mind, could you maybe introduce yourself to folks who are watching and down a little bit?
Sure. First of all, I very much apologize for being late. I couldn't find this stupid link. I'm sure many of you have been in the same position. I couldn't forget somebody's name who's Johnny Mexico. So I was searching for Johnny Mexico, but the link wasn't sent by Johnny Mexico. So anyways, here I am. So my name is Mark Tyndall. I'm talking to you from Vancouver. I'm an infectious disease doctor, but I've been involved with harm reduction for 20 more years, mostly in Vancouver, but also in Ottawa. I actually trained, my infectious disease training was in Winnipeg, so I'm somewhat familiar with living in Winnipeg for over 2 years. My project now is called MySafe, which is a dispensing machine that gives people hydromorphone as a safe supply. But I'm interested in all aspects of harm reduction. But how I've really learned to focus on safe supply is my experience, a lot of experience with Insight and other supervised injection sites that have come up in Vancouver. And there comes a point when simply standing, watching people overdose on drugs that could kill them, doesn't make any sense anymore as far as what our response should be. So, meaning it doesn't make any sense. Of course, that saves people's lives, and I've had days when we've seen 10 people go down and would have died without naloxone and oxygen, but it just becomes ridiculous when we have other alternative drugs people could be using, and we're just watching them use poison. So that's in a nutshell where I come from.
Awesome. Thank you so much for that that introduction and for sharing a bit of your background, and that answered the question that we were talking about anyway, which is really great. I just wanted to open the conversation up with, just sharing like what are safer consumption sites and why, basically, from our perspectives. So thank you for that. Glad you found the link. And maybe we can, Johnny, you can kind of wrap from your perspective.
Yeah, so I mean, a safe consumption site is pretty much self-explanatory, but other things that definitely tie into that are overdose prevention, as Mark touched on, and Jacob there. Like that is one of the key functions. Mm-hmm. And how those sites are able to do that is by providing safe spaces for people to come in, so they're not rushed in setting up their drugs and drawing their drugs. So people are able to do the drugs that they want with the type of, like the measurements that they want. They can sit down. They don't have to, nobody has to rush. And when you rush is when you make mistakes and you miscalculate or whatever. So I think that's a really key thing. I mean, the other thing that I really want to touch on here too is because of the lack of government support, is that peers have done a lot of peer-led intervention in monitored consumption sites out of their homes, out of their backpacks, folks that are walking around with naloxone, looking after their friends and their relatives here, and doing this work unpaid. I can tell you that we did a small satellite site project here through the Harm Reduction Network, and some of those folks were doing supply distribution out of their homes or out of their backpacks, and had reversed 6 overdoses in a very short time period for the project. So it's something that is 100% needed. It makes financial sense. It makes humanitarian sense. And it's something that we just need to get done.
Okay, so something that and you kind of just touched on it actually, Johnny, that I did want to get into a little bit. You said it makes financial sense, it makes humanitarian sense. I think, when we talk foundationally about why these sites are important, the humanitarian aspect certainly stands out. I think that people can understand that. But from the, I guess I think about my nursing background, from a medical perspective, from a systems perspective, why does it make financial sense? Like, why can you you folks elaborate?
Yeah, I can kind of just pull off what Mark said at the site that you mentioned, Mark, where there was 10 overdoses in that one day, and people were on site and were able to help and reverse those overdoses. That's 10 paramedic calls that would have gone out, 10 hospital visits, 10 ER visits. Like, I mean, I hate to put things like human life into a cost analysis, yeah. But if you're just kind of talking just nuts and bolts, like there's a really good analysis right there. The strain on our medical system right now is massive, and and we're talking in these COVID convos, like the amount of stress on ERs, on hospitals, on first responders. These are things that could be dealt with in a timely manner at overdose prevention sites. Folks can get the assistance that they need, and go on with their day and with their lives.
Okay. So I'm wondering if we can chat a bit about, from the perspective of folks in community, like it's interesting when I hear you talk about, folks who are providing support and resource out of their backpacks, right? Like folks who are doing this work unpaid in community. So what, from the perspective of folks who are doing this, like basically frontline work, like that's on the ground in community work, what are some ways in which safer consumption sites have to function in order to actually meet the needs of community? What are some key components that have to exist within these frames in order for them to be effective and meaningful? Jacob.
If we were to set up a safe consumption site here in Winnipeg, it would have to be the key thing would be staffing, honestly, and getting staff that care about all people, that treat people like people, everyone. A welcoming place, not a medical, this is where you sign in, very professional place, a laid back, relaxed place. And that's still very professional in the background. But when you walk in, it doesn't have that institutional feeling. When I was working at shelter in Surrey, BC, at the Parkway shelter, behind the shelter in the courtyard, we had a safe smoking area. And it was just, all that was a table set up under a gazebo, and 6 people at a time were allowed to come and smoke their meth, crack, coke, heroin, fentanyl, whatever, just not cigarettes. And there was no institutional thing. It didn't feel like a prison. We were opening, we were welcome. We went and talked to the people because it's out in the open. So the number one thing would be staffing. Get staff that just care about people and want to save lives. And we'll look at these people look at us not as addicts, but as their family. It could very well be their brother, sister, father, mother, what have you. So that's my opinion on that.
Okay, thanks, Jake.
There's it's amazing that we're actually having this conversation, that we're trying to convince cities that they need a supervised injection site. I mean, inside, 20 years ago, it was shown that it was effective. It wasn't, though, until 2016 in British Columbia that the provincial health minister allowed sites to open and mandated the sites should open. And in about 3 months, 20 sites opened up in across British Columbia, in communities that if you had have taken a poll and asked if people wanted one, they would have voted down. 90% of people would not have wanted one. And they were set up, mostly led by community activists and concerned people. And it didn't really make a difference, like, as far as the community goes. Like, all this concern that, everything would fall apart and that there'd be like mass outcry, and none of that happened. And all of these sites just kind of, after 24 hours, they just became part of what was happening in those communities. So all of the concerns that the political leaders have and the community has, what this would mean to their community, are just like made up stuff and lies and excuses. And I think that really what it takes is, we spend far too much time talking about all the things that could happen and all the things that could go wrong, and we're just showing that does not happen. So it's a human right that people do not are not chased around by police and having to inject in gutters and alleys. I mean, it's so disturbing that in a place like Canada we think that was okay. And so we take the most vulnerable, traumatized people in our community and expect that they're going to be doing their activities under extremely risky and unsanitary conditions. So it's just, it's time just to do it. I mean, communities who are still, finding so much opposition to this, it's just really based on kind of lies and misconceptions, and these are people's lives at stake, and we just have to open them up. There's just no reason that you would not. And I think Jacob's point about what these places should be, they're not set up to get people off drugs. They're set up to allow people to use the drugs in a safest way possible with supports that they need. And Insight, which was the first one in North America, became too medicalized. I mean, it came under the health authority, and when there's 5 places that people can go to in the downtown east side, and Insight is probably the least popular one because of all the attention and all the do-good that people think they're doing by adding all these medical parts to the services. And the ones that are people like going to, there's no questions asked, there's no judgment. You just use your drugs. If there's days that you reach out and would like to talk to somebody, somebody's there and can help you with services. But these are not opportunities that anytime somebody comes in with some drugs, it's your chance to pounce on them and get them into medical care and detox. I mean, these are supposed to be, this is for people. People want to feel comfortable. Most people go in there with their heads down with their drugs. They use their drugs and they leave. And that's what they want to do that day. And for the time when they need some assistance or they're ready to ask for some assistance, there should be somebody there to help them. And there's plenty of that around. But these should not be medicalized establishments where you have to like talk to a nurse and everybody's asking you how you're doing that day. Most people say, well, actually today I'm doing pretty shitty. I'm using drugs all the time. I don't have a place to live. And, why are you even asking me? Just, so look at the situation I'm in. So people want support and they need the people around that they can talk to and feel comfortable with, but it should not be set up as some way to get people off drugs and to jam down medical care and all these things that people are just not ready and just don't want right now. So
I agree.
Like,
Yeah, I love what you just said. Sorry. People just don't get that reality of addiction or anything for that matter, where you can't force someone to do something, because it's forcing them to do something that they might want. Sit back and listen. Sit back and watch. If someone wants help, they'll come to you. And that's an amazing feeling too, when people do come to you for help.
Johnny, do you have any thoughts on what's been shared?
Yeah, I completely echo what Mark and Jacob have said. Well, one of the things that I just kind of want to chat a little bit about what Jacob said about the safe smoking site. I mean, there's not a lot of those in Canada.
Yeah.
And I think that any type of model that we look at here in Winnipeg has to look at all of these things. Like what are folks wanting? What do they need? And then let's not be afraid to do it because of some weird stigma bullshit that gets attached to the way people decide to use their drugs. Okay. So I think that's something that's really important, is that we don't get kind of tied into just thinking injection, okay. that we are able to accommodate folks in all of their needs. And I would love to see it open 24/7. 7 days a week. People use drugs at all times. And it was one of the biggest criticisms around Insight was that, I mean, it was great that it was open, but then at 6 o'clock or whenever it closed, what are people to do? Like, it's not that people stop using drugs at 6 o'clock or on Sundays or whatever. So it's important to take a look at all of these different things and be able to provide solutions to what everybody needs.
Okay. I mean, what you folks are saying makes sense to me. Like I hear this and I'm like, okay. And there's been a couple of things in this I've been like, oh, okay. I hadn't actually thought about that point exactly. And I get where you're coming from. Something that stands out to me is, and I hear this from all of you, that sort of, it needs to be something that isn't so medicalized. It needs to be something that doesn't feel institutional. It needs to be something that, doesn't have a lot of the barriers or reasons which folks are, not interested in engaging with the medical system, being what's at the forefront. So I guess a question that comes to mind for me, what are some components, like medical components to these supervised sites that do need to exist, that do need to be in place? Like what are some aspects of that and I'm thinking this is like my nurse brain, right? I'm like, well, okay, I hear you. But so then what are the key medical aspects of it that, that need to be a part of it? And what specifically in terms of Winnipeg do we really need to think about in terms of the context here? Two-part question. Jacob, I saw you kind of like don't.
We honestly, it shouldn't be specific to Winnipeg. It should be across the board. It's BC wasn't the Vancouver wasn't the first. Someone else did it. It's an across the board thing, and we should, for medical, just have a nurse on duty. Have a kick-ass nurse on duty. Sorry, who won't judge people, who doesn't give a shit if they're white, yellow, red, black, green, alien. It doesn't matter. Have staff on there that care. Have staff that are trained in oxygen and proper use of the BVM, the breathing bag. Really, that's it. And have staff there that will give that extra little bit for when the people do want to open up. I can't stress that enough. I know that we're talking about building places where people just come and use, but the reality is that in my experience anyways, you always, as a staff member, as a worker, will build some kind of communication, some kind of relationship with that client. And whenever that client is ready to do whatever they want to do, as whatever their next step is, do it. I mean, the reason I got clean is because I decided on my program, what works for me, and that's not smoking heroin. That's what works for me, and I had to figure that out. And the staff at Main Street Project, who I actually went to when I arrived here 21 years ago, half dead, they just let me figure out my plan and then help me with what I wanted to do. And we have to have staff like that who just listen to people. Less talking, more listen to what the person is saying.
Yeah, I totally think that there should be some medical care there, because that may be the only opportunity people have to get any medical attention. So, but it really needs to be initiated by the person. I mean, even something as obvious, if somebody comes in with a big abscess, and the medical view of that would be, oh my God, this is a terrible abscess. You need to get some attention. But it's possible that day they're just not gonna do it. They just don't. That's just not their priority right now. So it really needs to be driven by the person using the site. I think that maybe it's for financial constraints, maybe it's not possible to have a nurse there all the time. Even if you said Monday, Wednesday, Friday afternoons, there'll be a nurse on duty if you want to get your wounds looked at or something like that. I mean, people will come when they need it, but it just really can't be forced on people. And so it really needs not to, but as Jacob said, some nursing or physician that really understands and is not driven by trying to be a savior to that person, but just being there to serve them when they ask for it. If I can just make one quick comment about the smoking, I think that's one of the biggest failures of harm reduction, and the messaging that we've given to people for 25 years since HIV, or 35 years, is that needles are bad. Like, you can get HIV and hepatitis C and abscesses, endocarditis. And so a lot of people know that and would rather not use needles. We've given them no alternative or safe or effective ways to use the drug. So you still see people burning it on tin foil and Coke cans and using homemade tubing. Like, it's ridiculous. The technology that's available through nicotine vaping and things is remarkable. Like, we should be putting these drugs into usable ways that people can safely use them. And so I think we've totally neglected that. We've told everybody needles are bad for you, which I believe there's a lot of bad things that happen when you use needles. And there's a lot of people who can't really use needles anymore because they've butchered all their veins. And we've given them literally no safe alternative ways to use these drugs. I mean, I guess meth pipes, but there's way better technologies that we could be using and offering people that we just haven't done. And as far as supervised sites for it, again, there's very few places where people can go and smoke their drugs under supervision, and at least half the people who are regularly using drugs would rather not use needles, and there's no place to go. So.
Okay. I saw your head nodding at some of what was being said there, Johnny. Do you have some thoughts you want to share on that specifically?
Yeah, I just to kind of get back to the what are some of the medical things that need to be there, not need to be there, and I think the most important thing is to center the experiences and voices and expertise of peers. So like the thing needs to be staffed by peers, directed by, like, basically run by folks who understand and know how to do this.
Okay.
And it's almost like the medical staff should just take a back seat, like get out of the way and listen, right? It would be great if that could happen.
Yeah.
And like that type of a model would be wonderful. These are the things that folks are telling me that they want. Jacob, what do you have to say with that?
So when I was in BC, when I was working at the shelters, we always had one staff, one peer support worker on duty. So it was always 2 and 2, always together. Well, except when no staff showed up, and I ended up working the shelter and the safe. Yeah, but it was a lot of peer-led activity. A lot of what you're hearing now with the peer support workers in Vancouver getting unionized, that stems from this kind of work. So working specifically in safe smoking sites. So and safe consumption sites all around, injection and such. But yeah.
Okay. So I'm curious because, this is the safe smoking sites, like the conversations around how folks are using substances isn't something that has been that prevalent. It's certainly not something I'll say in some political circles, let's say, or even in just a lot of conversations that I've heard and have been a part of. There hasn't been a ton of dialogue around that, around the different ways in which folks can safely use, and what that can and should potentially look like at a supervised consumption site. So I really appreciate that that's come up now a few times. And I'm just wondering if that's something that you folks are thinking we really need to be intentionally having some structured conversation around here in Manitoba, because the reality of it is we know efforts are being made to get these sites established. We know that City Council, for example, supported a motion put forward, I believe, by Councillor Rowlands in regards to supervised site. So is that a piece of this dialogue that maybe isn't seeing the attention that it should? Just putting that out there for you folks. Yes, Jacob.
Sorry for being a chatty. A lot of the time it's the stigma that everyone who uses drugs are just dirty junkies that stick needles in their arms or necks or what have you. There actually isn't. In regards to drug use, you think of smoking with the marijuana and the crack cocaine. You don't think about, smoking meth. People's minds traditionally go to that, to the injection instead of the smoking. It's just not a conversation, because off the top of people's heads, it just don't, when they hear of drug addiction or people using drugs, they automatically think, junkies. So, or people who choose to inject. So
Okay.
I think that fentanyl has changed quite a bit also, as far as what drugs are available and how people use them. So, way back, when I did live in Winnipeg and was a little familiar with the scene, and my time in Ottawa, there was no heroin, basically. So, the opioids people used were almost all diverted pharmaceutical drugs and pills that people crushed and injected, and some people snorted them, and heroin was kind of unavailable or a luxury to get. And then since fentanyl came and replaced it, now you have another synthetic, very powerful opioid that's now available across Canada, and people can inhale fentanyl. So that's quite a common way to do it, much like they do it with heroin, chasing the dragon or using foil and things. And it's, that's what we should be encouraging people to do. You're probably less likely to overdose, although it still is a way to overdose, but mainly because, again, we've given people such poor ways to do it. They've kind of made it up themselves. So if you buy a little a little powder of fentanyl and you put it on some foil, your nose is like, a millimeter away. You don't want to miss any of that because you just bought it. So people can go down on it because they take so much, they take it all up at once, and it's absorbed very well that way. But if we could make it a safer way to do it, and people don't feel that they have to, use it like that, it technically is a much safer way to use drugs rather than inject the whole thing. And once it's in your veins, it's gone. So although inhaling fentanyl certainly leads to overdoses, it isn't as dangerous as, and you should be able to monitor and take it in a little bit slower than you would injecting a bolus of fentanyl into your veins. So we actually should be encouraging people to use, not to use needles as far as safety goes, and as far as other complications with using needles. But again, we've totally ignored that. We don't bother with people who smoke. We don't offer them any services. And as you just said, when you're thinking about setting this up, I think that's a prime thing you should set up. Winnipeg's got the added challenge of outside spaces all year round can be quite challenging. I don't know how you maybe by the time you inhale it, it's already frozen. It doesn't get to your nose. I don't know, but the reason why people don't do it inside, obviously, is employment safety kind of regulations and stuff that they don't want people around. I think technically that's more worry than it's worth, but I think with just some basic ventilation areas, you could have indoor spaces where people are using it, not using needles.
Okay. Thank you for that. And Johnny, do you have any thoughts on that?
No, nothing really to add. I totally agree that there's a space in this conversation that has been left out, and that is like the smoking gets so caught up in one particular thing. And there's definitely a need for it here in Winnipeg.
Okay. So, I mean, I think we've covered a lot in terms of like the whys, the what is it? How can it function? Why should it function a very specific way? Who should be there? If folks shouldn't be there staffing it. So based on the fact that, we don't have this yet here in Manitoba, but we do know, we've seen what's happened in other jurisdictions, and Johnny, you kind of touched on this already in terms of, and Dr. Mark, you brought this up as well in terms of what maybe changed over time in other jurisdictions that maybe doesn't have folks accessing it the way that they have historically. So kind of with that in mind, what are some lessons that Manitoba needs to learn from other places that have been doing this work, and make sure that whatever gets established here is not kind of repeating some of those maybe missteps or those lessons, right? What's something that Manitoba really needs to consider and to avoid some of those repeat lessons, to learn from that, and to maybe it would be wonderful if we really set the standard, the gold standard for how this can be done. What are some things we have to think about here in Manitoba?
That is a great question. So some of the things that pop to mind right off the hop, supervised consumption site and hand in hand with drug testing, right? So machines that will be able to test your drugs where you go in, you can check your drugs and go, oh, okay, this is exactly what I thought it was, or no, this is not at all what I thought it was, and now maybe I can reassess what it is that I'm going to do. Things that make things safer for folks. I also think about ways that supervised sites or monitored consumption sites can go to people instead of having people come to them. Mobile site sounds like a lovely idea. I went to a presentation where a fellow in Scotland was put together a mobile site and took it out on the road, and it was super effective because he could go places where people wouldn't. Sometimes it might be too far to get to a site, or you don't have bus fare or whatever.
Yeah.
So the site went to the people. That was a brilliant idea. So there's a lot of things that can have added benefit for a monitored site or an overdose prevention site. The drug testing is I think it's a huge thing where people can really inform decisions about what's going on, and then we have up to date information about what's in our drug supply in Winnipeg, and can have alerts going out, and people can make some choices. The mobile site, the all hours thing would be just wonderful, because I think those are key takeaways from Insight, and also the non-medicalized model. Having more cultural supports and things like that around for folks would be ideal. Peer led. I mean, I could go on, so I'm going to toss it over to Mark or Jacob to see if there's things that folks could add there.
I mean, one of the things that probably happens in places is something like Winnipeg. There's a real push to get one open. You'll find a place, you'll get it open, and then people will just rub their hands and go, "Okay, we did it," and there'll be nothing else happen. And so we knew from Insight that 90% of people wouldn't go more than 2 blocks to get in. So the downtown east side is a really unique place where there's just not that concentration of people anywhere else in Canada, probably North America. So you could fill this place up quite quickly just with people who lived right around the site. But in most cities, it's not like that. So I would say that it would be way better to have 4 small sites than 1 big site, because people do not travel much, especially with the weather conditions in Winnipeg. I mean, in the middle of winter, you're not going to, walk 20 blocks to go to this place 5 times a day, So I think small places where multiple small places are much more effective than 1 large place if you want to reach people. You have to understand that it's only a small proportion of people who want to come and use these places, because it's a criminalized activity. People had been forced to use in isolation, and that's what prohibition and criminalization has done to people over decades and decades. And so it's a change. You have to change the whole culture. People aren't used to getting together in a place and injecting where other people are injecting. So it's a shift in culture, and one way to do that is to have small sites. If you had, especially in housing, you should open up no supportive housing unless there's a place people can go in that building to use safely under supervision if they choose. I think there's a progression in thinking, Johnny, at least get people to get their drugs tested or have the opportunity. I think you go the next step, you have a machine there and people get drugs and use right when they get there. So people should just pick up hydromorphone at the door and use it, and just get rid of the whole, as we know, 80% of the hassles and the risk people take are before they even get to the supervised injection site. It's how to get your drugs in the first place. And that's where you put yourself at risk, and the violence associated with, accessing the drugs. And so you can take that away. The people that I have on this MySafe machine who get up in the morning drug sick and just come and get their drugs, it's life-changing, not having to go and desperately search for where you're going to get your hit. So anyways, I think, a non-medicalized, very low barrier place that's small and convenient is how people are going to use it. The drug testing would be the next step, and then ultimately, we should have a regulated, safe supply of drugs for people to use. And they obviously should be put in places where people are coming to use drugs. And you want to use drugs, use these ones, because you won't die. So.
And Jacob, do you have some thoughts on this one as well?
No, I was just listening to Dr. Mark and thinking, shit, where would I be if, like, 25 years ago, I could walk into a place when I wake up before work and get my fix, do it, go to work, after work go get my other fix, party a bit, go get another one safely, and then go to bed. Like, man, I'm just thinking about how my life would be.
That's what
Man,
alcoholics do. So
yeah,
that if you're a
exactly.
drinker, that's what you do. You go get safe beer and you drink it for to work, and then you go to work and then you have beer when you get home. So we've
Exactly.
yeah.
I'm just
Yeah.
thinking how awesome that would have been.
Yeah.
Man, how many people would still be around? Damn.
Yeah.
I can't stop thinking about that too. Like, just, yeah.
Yeah, yeah. You know, it's interesting because, you know, these are the parts of the conversations. I think it's, you know, it's easy to sort of have the conversations around supervised consumption sites and keep it in a certain place, and to not dive into some of the more nuanced aspects of the conversation, or things that might push people a bit more out of their comfort zone, when in reality, you know, again, if this is something that this is something that needs to happen here in Manitoba, it's also an opportunity for Manitoba to do it in a way that, like I said, learn from lessons from other jurisdictions, and also be forward thinking. You know, also do something that doesn't leave people behind and out of being able to access. And maybe, you know, again, I think that we can and we should push ourselves to sort of set the standard and really go the distance. And that means having these conversations and listening, you know, as Johnny has said a couple of times already, listening to the folks who are the experts in communities who are already doing this work unpaid, you know, getting feedback from where we need to get the feedback. And I really do appreciate the comments around, you know, not making this so medical, because inevitably we do know that sometimes that can get in the way of folks getting access and getting, you know, what they need and their needs met. So I want to make sure that if there's questions in the chat or anything, that we can get to that before we wrap up. And I have no idea how to do that. So Jude, I know you're I know you're managing everything tech wise. If there's any, I saw a comment earlier kind of go across the screen, but I didn't catch it. So, oh, there it is. Okay, so there's a comment here. I'm a believer in getting 5 safe consumption sites in the police department, 25 for the fire departments, 40 for the first responders, 80 to 125 for businesses, commercial. So I'm going to put, well, I think you can all see the comment, right?
Mm-hmm.
Folks, any thoughts on this? I'm going over this in my mind. I'm trying to make sure that I understand the comment completely. I'm a believer in getting 5 statements. Okay. Anybody have any immediate thoughts on this comment? I see this person basically saying that they're a believer in getting sites established. And I think it speaks to your point, Dr. Tyndall, about having a number of sites. Better to have smaller sites, a number of sites versus one gigantic site. This pandemic has me thinking about super sites, and how we know that super sites aren't like the most accessible way for people to get what they need for so many reasons. So anybody have any thoughts on this, though, on the number of sites and location and proximity and all of that?
Well, I think the person wants to make a case that there needs to be lots of sites and lots of opportunities. I would think that the 5 worst place to put it would be near a police station. The next 25 worst places would be a fire department. So, I mean, this is still a legal stigmatized. So the police are not the place where you'd want to have a site. But I think the idea that you need, you know, a range of all options for people is a good point.
Cool. Okay. Yes, Jacob.
The Parkway shelter was here. In front of it over here was Gateway shelter. Over here was the safe consumption trailer. And right in front of that with the chain link fence, in between it was an RCMP detachment. At no point in my year and a half, 2 years working there did I ever see the police misuse their powers. In fact, people felt safer, oddly enough, in that situation, because they knew that if someone, it's Surrey, there's guns, there's lots of guns, so people felt safer, and the police that worked in that detachment were 100% harm reduction. So it all depends, again, what kind of people are around. If you get that dick cop, then things are going to go bad. But the police never did raids. They would never just never once walk into the safe injection site or safe smoking area. They weren't there watching. They would actually help. And again, that's Vancouver's and the Lower Mainland specifically. The police down there are a little more forward thinking with drug use, just because it's been going on for longer there than it has here. So with the opioids and like you touched on, like the reason I moved here is because there was no heroin here. So it's yeah.
Okay. I think, yeah, that's, and I want to thank this person for their comment, because, you know, again, like, these are parts of the conversation that are important to be had, and it's important to hear people's thoughts and feelings and perspectives on this. I mean, I have lots of thoughts and feelings that come up too in regards to this, but I certainly recognize that what's most important is, like, how are people in community going to, process this, and what are the needs that they're identifying. And so, Johnny, you've got 1 minute left, if you wouldn't mind providing your thoughts before we wrap up.
Yeah, I just really want to hit on the importance of having these in communities where folks are already experiencing, where there's a lot of drug use, a lot of open air drug use. And I want to acknowledge that, workers at Tim Hortons, because their bathrooms are there, are now de facto workers in monitored consumption sites. And that they're not trained for that. They don't have the skills for that. And it's really unfair for workers in those situations. I'm glad that some places and businesses do that, provide places where folks can use, but that's not their job. Their job is serving coffee and doing other things. So it's really important that we have these locations in communities to help support these businesses, to provide places for people to use drugs that's not in the Tim Hortons washroom. So I think that's a really important takeaway is how can we also help businesses in the area and communities in the area and provide safety, because, like, drug users live in these communities, they're part of our communities. And how do we make better, stronger communities? We make better, stronger people with better, stronger infrastructures. Beautiful.
I love that. I think that's a really strong finish. So thank you for that, Johnny, that mic drop. Folks, it's been such a productive and powerful and informative conversation around something really, really important. It's been great to get to know you, Jacob, and you, Mark Tyndall, on this subject as well. And I really hope that if you've got questions, reach out, let us know. We want to hear from you. We want to know what these conversations should look like moving forward. But that's it. That's a wrap. So thank you for joining us. Thank you so much to all of our folks here this evening contributing. Everyone stay well, stay connected, stay safe, and we'll see you again soon. Take care.
Thank you.